Did you know that anxiety disorders affect about 1 in 5 people worldwide? That's nearly 20% of the global population. This staggering figure paints a picture of a silent epidemic, a pervasive disease that's often overlooked, misunderstood, and at times even stigmatized. Anxiety disorders are not just about feeling nervous before a big event or worrying about day-to-day life. They're about an overwhelming sense of dread that can hinder one's ability to function normally. Understanding anxiety disorders is not just important, it's crucial. It's about recognizing the struggles of millions of people around us. It's about fostering empathy and compassion. But more than that, it's about empowering those affected to seek help and break free from the invisible chains of anxiety. In the next few minutes, we will take a closer look at what causes anxiety disorders and how they can be effectively managed. Anxiety is more than just occasional worry or nervousness. It's a persistent state of fear or apprehension that can disrupt your daily life. And that right there, my friends, is the crux of an anxiety disorder. Anxiety is a normal part of life. It's that little knot in your stomach before a big presentation, or the quickening of your heartbeat when you're about to meet someone new. It's a natural response to stress, and in small doses, it can even be beneficial. It keeps us alert, helps us prepare for upcoming challenges, and can motivate us to solve problems. But here's where anxiety disorders come into play. When this feeling of worry becomes overwhelming, when it's constant and out of proportion to the situation at hand, then we're venturing into the realm of anxiety disorders. It's like being stuck in a continuous loop of fight or flight mode, even when there's no immediate threat. This can interfere with your daily activities, making simple tasks seem insurmountable. Now, there isn't just one type of anxiety disorder. It's an umbrella term that encompasses several different conditions. There's generalized anxiety disorder, characterized by chronic anxiety and excessive worry, even when there's little or no reason to be anxious. Then there's panic disorder, where you experience recurrent, unexpected panic attacks. We also have social anxiety disorder, where everyday social interactions cause significant anxiety, fear, or embarrassment. And let's not forget specific phobias, an intense fear of a specific object or situation. The list goes on, but the common thread here is a persistent and excessive fear or worry in situations that most people wouldn't find threatening. It's like having a smoke alarm that goes off when you're simply cooking dinner. It's disruptive, exhausting, and can make life seem like an uphill battle. And that's why it's crucial to understand what an anxiety disorder is. It's not just a case of nerves. It's a serious condition that can have a profound impact on a person's life. Understanding the root cause of anxiety disorders is the first step towards effective management and treatment. So stay with us as we continue to unravel this complex topic. The causes of anxiety disorders are complex and multifaceted, involving a mix of genetic, environmental, and psychological factors. Let's start with the genetic aspect. Just like the color of your eyes or your height, anxiety disorders can run in families. Research shows that individuals with a family history of anxiety disorders are more likely to develop one themselves. This doesn't mean that if your parents or siblings have an anxiety disorder, you're destined to have one too. It just means that your odds may be slightly higher than someone without a family history. Next up, we have environmental factors. These can range from stressful life events, such as a major illness, loss of a loved one, or a traumatic event, to ongoing stressors like job-related stress, financial difficulties, or relationship issues. These stressful experiences can trigger an anxiety disorder in someone who is already predisposed to it. It's also important to mention the role of underlying mental health conditions. Conditions like depression, bipolar disorder, and eating disorders often coexist with anxiety disorders. These conditions may not cause anxiety disorders, but they can exacerbate symptoms or make it more difficult to manage anxiety when it arises. Lastly, psychological factors play a significant role in the development of anxiety disorders. For instance, certain personality traits such as shyness or behavioral inhibition in childhood can make a person more susceptible to anxiety disorders. Similarly, having a pessimistic or negative worldview can also predispose someone to anxiety disorders. Understanding these factors is essential, not to place blame or point fingers, but to shed light on the complexity of anxiety disorders. It's not just about being too sensitive or overthinking. It's about a unique interplay of genetics, environment, and psychology. The more we understand these factors, the better we can support those struggling with anxiety disorders. Whether it's through early intervention strategies, providing supportive environments, or challenging harmful societal beliefs about mental health, every bit counts. Recognizing these factors can help identify those at risk and provide timely intervention. And with that, we move on to the next segment of our discussion, managing anxiety disorders. Stay tuned. Anxiety disorders can be overwhelming, but the good news is they are manageable. A combination of therapy, medication, and lifestyle changes can significantly improve quality of life. Let's talk about these strategies for managing anxiety disorders. Cognitive behavioral therapy, often referred to as CBT, is a type of talk therapy that helps you understand and change thought patterns that lead to harmful behaviors and feelings of anxiety. It's like having a personal guide to help you navigate the labyrinth of your thoughts and emotions. Medication is another option. It's not about numbing your feelings, but rather, it's about rebalancing the chemicals in your brain to help you manage your symptoms. It's important to remember that while online searches can provide information, they are not a replacement for professional medical advice. Consulting a doctor or therapist is always recommended for proper diagnoses and treatment plans, and medication should be taken under the guidance of a medical professional. It's not a one-size-fits-all situation, and what works for one person may not work for another. Then we have lifestyle changes. Exercise, for instance, can be a powerful anxiety reducer. It's not about running a marathon or bench pressing a small car, but about moving your body in a way that feels good to you. Yoga, dancing, even a brisk walk around the block can make a significant difference. Diet is another aspect to consider. Foods rich in magnesium like leafy greens and omega-3 fatty acids found in fish have been shown to reduce anxiety symptoms. Limiting caffeine and alcohol can also help keep anxiety at bay. And let's not forget about the power of a good night's sleep. It can work wonders for your mental health. Establishing a regular sleep schedule and creating a comfortable, quiet sleep environment can help you wake up feeling refreshed and less anxious. Lastly, remember the importance of self-care. This can be as simple as taking time to relax, reading a book, or spending time in nature. It's about finding what makes you feel peaceful and content and making it a regular part of your routine. Seeking help is not a sign of weakness, but a step towards reclaiming your life. Managing anxiety is a journey, one that's unique to each individual. It's about finding the right balance of strategies that work best for you. So, be patient with yourself, and remember, you're not alone in this. Treatment for anxiety disorders is highly individualized and often involves a combination of approaches. One of the most common methods of treating anxiety disorders is psychotherapy, also known as talk therapy. This approach involves speaking with a mental health professional to understand and learn how to deal with anxiety. Cognitive behavioral therapy, a type of psychotherapy, is particularly effective. It helps individuals identify and change thought patterns that lead to anxious feelings. Another widely used treatment is medication. Several types of medications are used to treat anxiety disorders. To know which one best works for you, you need to speak to a medical expert. Treatment, however, doesn't stop at psychotherapy and medication. There are also several alternative treatments that can complement these traditional approaches. Mindfulness and relaxation techniques, for instance, can help reduce anxiety by promoting a sense of calm and well-being. Regular physical activity and a healthy diet can also play a critical role in managing anxiety. And let's not forget the importance of a robust support system. Friends, family, and support groups can provide a safe space to share experiences, feelings, and advice. They can offer a sense of belonging and reassurance that you're not alone in your journey. It is crucial to remember that seeking help is not a sign of weakness, but rather a step towards reclaiming control over your life. If you think you may be suffering from an anxiety disorder, reach out to a healthcare provider. They can guide you towards the appropriate treatment plan tailored to your needs and circumstances. With the right treatment plan, people with anxiety disorders can lead fulfilling and productive lives. Remember, it's not about eliminating anxiety entirely, but learning to manage it effectively. Thanks for watching this video. If you found this information helpful, be sure to subscribe to our channel for more tips or anxiety and other health and wellness topics.